What is PTSD or post-traumatic stress disorder? PTSD or post-traumatic stress disorder is an anxiety disorder that can arise after experiencing or being witness to a traumatic event that was life-threatening to you or someone you love. Who gets PTSD? Anyone who is involved in or witness to a traumatic event can develop PTSD. Common traumatic events include hurricanes, volcanic eruptions, tornadoes, tsunamis, floods, severe accidents, intense childbirth or complications, sexual abuse or torture, physical abuse, military combat, and terrorist attacks. 2 months after 9/11, 20% of New York residents were reported to have PTSD. 1 in 10 New York City residents had PTSD, as well as 4% of Americans across the nation. What are the symptoms of PTSD? Typically, they are divided into 3 clusters. 1. Re-experiencing and reliving, intrusive thoughts, feelings, and emotions, nightmares of the event, flashbacks, triggers, which would include gunfire, seeing an accident, watching a news report on a sexual assault case. 2. Avoidance and numbness, not talking, thinking, or feeling anything to do with the event, avoiding places or situations where the event occurred, emotional shutdown, unresponsive, uninterested in your normal activity. And 3. Physical arousal or hyperarousal, which would include problems sleeping, problems concentrating, irritability, outburst, anger, and a hyperstartle response. Other symptoms include fear, helplessness, horror, and anger, guilt, shame, sadness, and disgust. Often, PTSD individuals may also suffer from depression, substance abuse, employment problems, and relationship issues. How long does PTSD last? An individual that displays symptoms for more than 1 month after the event is likely to have PTSD. PTSD can last for several months and in some cases even years. PTSD can occur after several years of the event passing and come on with a sudden onset due to a trigger. How is PTSD diagnosed? A self-test can be taken to help decide whether there is a need for a professional. PTSD can be diagnosed by a primary healthcare physician, psychiatrist, psychologist, and brain scans. How is PTSD treated? There is hope. Treatment can help individuals not feel so alone. Educating victims can help them to talk about the event, modify any inaccurate ways of thinking, and develop techniques for dealing with their symptoms. Treatment for PTSD includes cognitive behavioral therapy with 2 approaches, cognitive therapy and exposure therapy, EMDR, eye movement desensitization reprocessing, and medication most commonly used for PTSD are SSRIs, selective serotonin reuptake inhibitors. And lastly, group therapy. 8% of the U.S. population will develop PTSD symptoms at some point in their lives. Don't be afraid to get help. Organizations that help victims of PTSD are the National Center for PTSD, National Veterans Foundation, PTSD Alliance, and the PTSD Information Hotline. If you think you may have PTSD, take the self-test provided at the end of the video and contact your healthcare professional.